Hello everyone, welcome again on TVAsia Telugu channel. This is a special series. This is called Sati series because we are going to bring you speakers, physicians and Sati members who are going to share very valuable information, especially health related information. As community members, you may want to know, you may want to learn how you are going to take care of your health. Sati, as we discussed earlier, means South Asian Total Health Initiative. Now, what is South Asian Total Health Initiative? It is a group of physicians, clinicians, healthcare providers, and health professionals who are voluntarily giving their time to educate the community. We had our discussion with Sati Director Dr. Kaur last time when we initiated a discussion about Sati series. Today, we have a very important guest in our studio, Dr. Pravein Khanna. Dr. Pravein Khanna is general as well as interventional cardiologist. Dr. Pravein Khanna is also a clinical professor, clinical assistant professor at Rutgers Medical School, also known as Robert Wood Johnson Medical School. Today, we are going to focus on the most important part of body, the heart. As per the American Heart Association and World Health Organization, South Asians are at high risk for cardiovascular diseases. Dr. Pravein Khanna today will talk to us about what it means to be aware about our cardiovascular health and what are those measures that we need to take in order to prevent those diseases in South Asia. That is us, Indians, Pakistanis, Bhutanis, Sri Lankans, Maldives, and all those who belong to that South Asian group. So let me welcome Dr. Pravein Khanna. Welcome, Dr. Khanna, to
Thank you, Varsha. It's good to be here.
It's my really great pleasure to welcome you on Healthline, a show that talks about all health issues. TVAsia Telugu channel welcomes you.
Good to be with you, Varsha. Thank you.
So when I start any discussion with any guest physician who appears on Healthline, our community members, our viewers, they really want to know who this physician is, what is so special about our guest, and they really want to know everything about you. So my first question will be, who is Dr. Pravein Khanna? And what is he doing as far as the cardiovascular health is concerned? So please give a couple of lines and introduce yourself to our viewers.
Sure. So as you said, I'm an interventional cardiologist. I practice in Central Jersey in private practice in association with the Robert Johnson Medical School and the Robert Johnson University Hospital, which is part of the RWJ Barnabas Health Network. So I've done 4 years of medical school. I did 1.5 years of MPH school. I did 3 years of medicine residency, 3 years of cardiology fellowship, 1 year interventional fellowship. So I've been practicing now for the last 6 years in private practice as well. So I've seen a lot of patients, done a lot of procedures, several thousand procedures, in fact. I take STEMI call at the hospitals, and I've been fortunate to see a lot of South Asian patients come into our cardiology practice and take care of them. And I've seen a lot of heart disease, which is one of the reasons I want to get involved with Sati, to make the people aware of how much heart disease there is in South Asians, because it really is the #1 killer of South Asians. It's the highest mortality of South Asians in the United States, actually. Compared to any other ethnic group, South Asians have the highest cardiovascular disease mortality. And there's a number of factors as to why, and it's been under research for many years, and we can go into that in more detail later on, but really promoting awareness to people to get screening in an early age and keep up following their risk factors is the best prevention to help prevent any type of heart disease.
So Dr. Khanna, I would like to take you into very simpler details that we can share with our viewers and really break it down for them what it means to be taking care of their cardiovascular health. But before that, if you can share a little bit about how you got involved with South Asian Total Health Initiative, and what was your goal, or what was your reason that you wanted to contribute to society? Because you know the typical stereotypical role of physician is that you make an appointment with me and then I will see you and then I will talk to you. So here is that you are showing your philanthropic side and volunteering in the community, sharing this knowledge and going above and beyond to do this, to ensure that the preventative health is prevalent in our South Asian community. So please tell me about your journey with Sati.
Sure. Dr. Gower, as you know, is invited me several years ago. I met her in the hallway at the hospital, and I had a great conversation with her, and she offered me to help come on board. And I was happy to. There's a website that the Sati has created that I've contributed to the cardiology knowledge for that website. I give a few talks at different events for Sati that you've been promoting, which is great. One talk I gave at Durga Mandir, which was very nice to promote South Asian heart awareness and what people can do to help prevent South Asian heart disease. Personally, I went into cardiology for many reasons, but one was my dad. When I was in medical school, he actually suffered a mild heart attack, and I was a second-year medical student at that time. And that's kind of what did it for me to go into cardiology. I have a family that's a lot of physicians in the family, and my brother is actually a cardiologist as well. So I went into cardiology, kind of following in his footsteps. But it's a passion of mine. I love doing it. I love taking care of patients. And I see people like myself who are young South Asians coming in to see me. And it's very humbling and very motivating for me to try to make sure that I take care of them. So I guess that's why.
Thank you, Dr. Khanna. So I have a question for you. I am sure you have seen multiple patients, number of patients who have walked in your clinic, or you may have also performed surgeries on many patients. Okay, do you have a story to share with us to emphasize how important it is to take note of all those symptoms that you are experiencing, and why you are not supposed to delay the treatment of those important significant symptoms? And what are those conditions which really needs emergent treatment, where a person should not be waiting at all, not even a second?
Right. So it depends how old you are, but I mean, typically they say if you have chest pain for more than 15 minutes to call 911. Patients that have risk factors for heart disease, they should be more concerned about having symptoms than someone who doesn't. In terms of in terms of procedures we can do lots of things in the office, lots of things in the hospital, but the idea is what to watch out for at home is you're looking for chest pain that's usually substernal with exertion, that oftentimes it begins with exertion and then it will progress with time. You can have shortness of breath with exertion. That's usually the typical sign. Sometimes the pain going down the arm is often noted. Nausea, vomiting, dizziness. Women tend to have atypical symptoms. So I'll sometimes get calls saying I had dizziness, lightheadedness, or something involving the neck. It's always hard. You always have to take the whole person kind of into account and decide what's happening. There's no one prescription fits everyone. Everyone is individually different. So you take the overall risk profile and you kind of make a decision. As I've been trying to say all in the last few minutes, prevention is the key. So trying to get in to see a physician early, I mean, there have been guidelines out there that have been published that they recommend South Asians the ages in the mid-20s and 30s to get screened with lipids, to go see a doctor just for typical screening. And I can mention later on where what the best screening test should be for the South Asians, because a lot of times, unfortunately, the mainstream medical community, which is not South Asian, don't cater or don't design their screening tests for South Asians. So one of the good things about Sati is we're trying to promote what those screening tests should be. It's not just lipids, but there's other lipid markers. BMI scores should be more stringent. So. I think I went off a tangent, but oh.
So, Dr. Khanna, I will just break it down to our viewers. What you recommended as far as prevention is concerned is just take note of your symptoms, especially chest pain. When you said it goes down under your arm, and as we say, the worst pain as if the elephant is sitting on your chest, that kind of pain, which is combined with sweating, a lot of perspiration, as if you have taken a shower. That's what I have heard, that when there is a heart attack,
absolutely,
that's the worst pain on the left side of the chest, and the person is actually drenching with sweat. And these are the symptoms you said that should not be ignored, and they need to seek emergent treatment, which is 911. But then you also mentioned about women that they have very atypical symptoms. And think about our South Asian culture and very stoic nature of women. And it may change from generation to generation, but I'm talking about 50 and above who are still probably who are immigrated from India, and they're still under that cultural impact. They may feel that, oh, it's fine. It's going to be fine. I don't have anything. Just the way you said, it's a typical symptom. And you have emphasized that for women, it's all the more important to take a note of the cardiovascular health. If you can emphasize, what are the risk factors, especially in women? Because there are some risk factors associated with their medication, their gestational age, etc.
Sure. So typical risk factors are hypertension, smoking, diabetes, obesity. Family history is a huge risk factor that we often see in South Asians. Those are the typical risk factors. Non-typical risk factors or non-traditional risk factors for South Asians can be other markers, which we can discuss, which are like lipoprotein A. Often patients will have HDL2B, that's much lower. People that have visceral fat. So you can have someone who looks visually not obese, but actually be internally obese and have more visceral fat around the organs, which makes them at a higher risk of having heart disease. Insulin resistance is another risk factor that is very prominent in South Asians as well. And that's a precursor that leads to diabetes and leads to cardiovascular events. So things like that.
I think the one terminology that our viewer may want to understand a little bit more in detail is visceral fat, because I think we really need to pay attention to. If you can elaborate a little bit on that one.
Sure. So around the organs there's adipose tissue that tends to deposit. And it's not the fat that you see around your tummy, it's the fat that you don't see that's inside the organ. So it's a way that we metabolize fat. Everyone's different, but South Asians tend to metabolize fat different from non-South Asians. And it develops as fat around the organ so that you don't see it. It doesn't mean that it's not there though, because it still creates the type of risk as someone else who is viscerally obese. So it's very misleading sometimes.
Dr. Khanna, how can they find out what kind of visceral fat they have? Are there any clinical diagnostic tests, or is there any screening that they can get it done?
So the BMI is typically the best type of screening that we use for obesity and overweight. And for South Asians, the BMI cutoffs are different than non-South Asians. For instance, you want to go for a BMI of less than 23 is actually what's recommended, whereas for non-South Asians, it's less than 25. Waist circumference is a big deal. For women, you want your waist circumference to be less than 31 inches, and for men, less than 36 inches. These are all guidelines that have been developed by Indian and American physicians years ago that need to be promoted more if they're not already. So those are the typical starting numbers I would go after. In terms of screening, in terms of imaging, people don't usually do the imaging test. It's more of the waist circumference and the BMI numbers.
న్యూజెర్సీలో ఇల్లు కొనాలని కానీ అమ్మాలని కానీ అనుకుంటున్నారా? మీ నమ్మకమైన నేస్తంగా మీ ఇంటి క్రయ విక్రయాలను చేసి పెడుతోంది మీ లోవి రియల్టీ గ్రూప్. వేలాది డాలర్ల మీ కష్టార్జితాన్ని, ఎంతో విలువైన సమయాన్ని ఆదా చేస్తూ కేవలం $990 నామమాత్రపు ఫీజుతో ఖచ్చితమైన, సంతృప్తికరమైన లావాదేవీలను చేసిపెట్టే రియల్ ఏజెన్సీ లోవి. అంతేకాదు, మీరు కొన్న ఇంటి మీద మినిమం 1% క్యాష్ బ్యాక్ మీ క్లోజింగ్ కాస్ట్ లో పొందగలరు. మరిన్ని వివరాలకు ప్లీజ్ విజిట్ www.lovihomes.com. కాంటాక్ట్ 908-304-9621 or 908-337-1289.
I wanted to know if you could elaborate on interventional cardiology. What is interventional cardiology?
Oh, sure. That's my specialty. So interventional cardiology is where we do interventional procedures, meaning we take a catheter, invasive procedures in the body. So we try to fix the heart through non-surgical measures. So we don't do open heart surgery, but we take diagnostic catheters and we take balloons and wires and stents to try to open up blockages in the heart vessels. Every heart has 3 vessels that feed the heart. There's one in the front, one in the side, one in the back. They have different names. One's called the left anterior descending, side vessel is called the left circumflex artery, the back vessel is called the right coronary artery. When we do a diagnostic catheterization, we're taking a catheter usually about the width of an IV tube, very small. We either put it through the arm, through the wrist, or we go through the groin. And we push that catheter up all the way to the heart vessels, and we inject contrast to visualize each of those vessels. And we can visualize them in real time and basically make a movie of the heart vessels. That's the gold standard of how to visualize heart vessels, is a diagnostic catheterization. Any cardiologist has been trained to do a diagnostic catheterization. The interventional cardiologist will then come in if the diagnostic catheterization shows there is a blockage in one or more vessels in different areas. It can be at that point decided if the patient needs to have a stent, an angioplasty, or they may take the patient off the table and decide to go for bypass surgery. Those are always options. But this is where my field comes in.
Thank you so much for sharing about interventional cardiology, Dr. Khanna. A lot of viewers may be a little bit scared of when they think about diagnostic intervention. What are those conditions where these patients really require a diagnostic interventional study?
At that point, when you're looking at doing a cardiac catheterization, you're past the age of prevention. You're past the risk factors that we talked about earlier to try to screen for and prevent. You're actually now developing symptoms of what could be considered as heart disease. You're having chest discomfort, you're having shortness of breath, you could be having palpitations. You may have come into the hospital with chest pain and you've spilled biomarkers that we detect in the bloodstream that are showing evidence of heart strain called the troponin level. So at that point, the pre-test probability or our suspicion of you having heart disease is now much higher at that point. And then we want to look to see where, if and where those blockages are happening. So then we do a catheterization at that point. And the risks of a catheterization, I mean, the procedure has been around now for decades. It's been refined. The risk of a diagnostic cath is very low. And I often quote the numbers of less than 1% chance of bleeding, infection, or kidney damage, less than 0.1% chance of heart attack, stroke, or death. Everything has a risk. It's not fair to say there's no risk to a procedure. But the diagnostic cath is a more benign. It's more benign than people think. I'll put it that way.
Which means they should not be scared of it.
They should not be scared of it, in my opinion. I do it every day, so I have a little different attitude about it. But they should not be scared of it. Especially in operators that do a lot of it every day. They should have confidence in their physician, and then they should understand the risks. And especially if someone's symptomatic, they shouldn't prevent themselves from having it done.
Thank you, Dr. Khanna. So going back to the Sati initiatives and preventative health, I would really appreciate if you could throw some light about the blood pressure, the high blood pressure. and there is so much confusion about it. And when you are addressing high blood pressure, if you can talk a little bit about the white coat syndrome as well.
Oh, sure. So white coat syndrome is when the blood pressure is only high when you see a white coat.
Like a doctor.
Like a doctor. So you come in the doctor's office and the blood pressure is 170. And then I ask the patient, what's your blood pressure at home? And they say it's 120. And they can show me evidence of it. They have proof. They can show me the blog. And some patients have Excel spreadsheets of their blood pressure. Really great. But that's what white coat hypertension is. But hypertension at home that's elevated and in the office that's elevated more than 2 times is considered hypertension. And patients that have hypertension at a relatively young age can be worked up for secondary causes of hypertension. So sometimes there's essential hypertension, which is this high blood pressure because it's high blood pressure and you're at the age to develop that. Or there are other causes of high blood pressure. Could be sleep apnea, could be from renal artery stenosis, could be endocrine related. So sometimes a physician will have to make a judgment call who they're looking at as to where the high blood pressure is coming from.
So when we're talking about hypertension, managing hypertension, or finding out whether I have high blood pressure, and considering South Asians' behavior and seeking healthcare, what is the age or what is the recommendation when they should be seeking care, such as preventative and screening care? Because Sati really focuses on get yourself screened, go and see your primary, take care of yourself so that you do not end up having chronic diseases.
Sure. I would say if your blood pressure is consistently in the 150s or higher, you should seek medical attention. You should let someone be aware of that.
Okay.
Usually less than that, depending on their age. So, I mean, you may not require medication. You may go see the physician, and they may be aware of your high blood pressure, and they say, "What are things you can do to lower it without taking medication?" That's often what we'll do first.
I think the first recommendation is the lifestyle changes, using the physical activity and diet. You try to control the blood pressure and other associated comorbidity, because nowadays we don't just see high blood pressure alone. We also see obesity, diabetes. So it's like a triad of metabolic syndrome that we see together.
Exactly.
And in South Asian, I think the earlier studies, even Sati had focused on, was the lack of physical activity among South Asians. And that study was about, I think, 10 years ago.
That's right.
Probably we need to revisit and see if Sati has a plan to initiate a study like that in future.
Sure.
So going forward with Sati's preventative initiative, I would really like you to focus on your website, because you created this website to encourage South Asians to understand the cardiovascular health and how they can take advantage of all the knowledge and all the information that is on the website. Sure.
Thank you. It's called SouthAsianHealthyLiving.com, all one word. And me and a few other cardiologists got together, and we put up a lot of information that's very helpful to South Asians to help prevent heart disease. Basically, some of the numbers and the terms that I've talked about with you already are on that website, particularly the goals, blood pressure goals, cholesterol goals, your waist circumference, your BMI goals are all on there. There's even a heart risk calculator as well. Exercise you mentioned, you'll find some helpful hints on how much exercise you need to do. The AHA actually recommends 30 minutes of moderate activity at least 5 days a week, or you can do 25 minutes of vigorous aerobic activity 3 days a week. And that amount of exercise has actually been shown to reduce our cardiovascular events. So there's helpful information on there that's geared towards South Asians that you can take a look at.
Thank you, Dr. Khanna. So as a South Asian yourself and now advising the South Asians, could you share your experience if you had South Asian patients and you were able to disseminate all this information to them? I'm sure most of your patients have access to your website. If you could share the experience with us.
Sure. So I'll just take an example. I saw a 45-year-old South Asian gentleman, say last week. He was concerned because his father had heart disease in his early 50s and 60s as well. So I did a screening lipid panel. I also checked for some other markers, including lipoprotein (a) and HDL2B, also CRP level. And his lipoprotein (a) came back very high. His LDL came back a little elevated. Total cholesterol wasn't bad, but his triglycerides are very high. So triglycerides we didn't talk about, but is very high in South Asians. It tends to come from a high carb diet, and tends to lead towards glucose intolerance, insulin resistance, and diabetes, so on. So triglycerides are a very important number that you want to look out for in South Asians. And if you can reduce your carbohydrates, that can help. So we also calculated what's called the Ascbd risk score, which has been put out there by the AHA, ACC for the last several years. But it's not designed for South Asians. So his risk factor score came out to be less than what's needed to be on a statin. But because his LPA level is high, I sent him for some screening tests, calcium score and a treadmill. I'm trying to look for reasons if he's already developed plaque buildup in his arteries, because that's what heart disease is basically plaque buildup, atherosclerosis that's developing throughout the artery. So we do an in-depth screening. I tailor my screening for South Asians. I'm not sure how many other cardiologists are doing that, but I think more and more are.
That was a great story, Dr. Khanna, which means that just because your test results are not typically within that negative or positive spectrum, if there is a doubt, if you have symptoms, then it's a good idea to go for some more specialized test in order to find out whether you really have that cardiovascular risk, and it can really give you greater and significant results, so that you can find out what's going on with me as a South Asian.
Right, it's more peace of mind also. And most insurances will cover a basic treadmill exercise stress test. And getting a calcium score is relatively inexpensive now. A lot of the radiology places are providing it for a certain fee, even if your insurance doesn't cover it. So those are some extra tests we can do. One thing I'd like to mention is currently statins are the main drug that are used to lower cholesterol and LDL. I mentioned a marker called lipoprotein (a), which tends to be higher in South Asians. It's actually in South Asian men, it's 50% higher, and in women, it's 40% higher. So that marker is known to have higher risk of heart disease for South Asians. There isn't a specific drug that's targeted to lower that. There are some beneficial effects from niacin and some of the newer injectable lipid agents like Prialin or Repatha. They have the side effect of lowering some LPA, but they're not designed specifically for that. There is a drug in the pipeline, though, that I'm very interested in for South Asians that's in phase 2 trials right now, specifically designed to lower LPA levels. And so maybe in the next couple of years, we will have something. And I think that will be very helpful for South Asians. And
definitely that information will be on your website.
I will put it up. That was not on there, but I'll put it up.
Yeah, I was just emphasizing that as you are putting the information out for South Asian pertinent to their needs, if there is medication which will be coming out in future years, which will be beneficial to them, definitely they can look it up and visit your website again to see some updates posted there.
Yeah, absolutely. Thank you.
So, Dr. Khanna, going furthermore towards Sati initiative, preventative health, and managing the chronic disease, if you already have a heart disease, what would be your recommendation to the South Asian population at large?
So if those patients who already have documented heart disease, they've already had a stent placed, or they have had a heart attack in the past, those patients are already following a cardiologist. I hope they are on a regular basis, or a physician on a regular basis, to make sure that their lipids are in check. Make sure they are on a good diet and lifestyle regimen. They are trying to exercise if they can. They're trying to make sure they lose weight if they can. that's probably the best thing they can do. Make sure they're taking their medications as prescribed. If they already have heart disease, those are at least the most important things they can do to help make sure that they live as long as they can.
Dr. Khanna, so most of the time, people do not seek care of physician unless they start developing symptoms. And sometimes they even don't visit physicians until those symptoms become really severe. So what is one message as a cardiologist that you can give these patients about getting the care as soon as possible?
Yeah, I think one of the benefits of COVID now is that telehealth has become so prominent now. I think the barriers to getting medical attention have been drastically reduced. So patients that are afraid of seeking medical help or don't want to make a big deal of things, I think just having a telehealth visit would be the simplest thing to start with. So to answer your question, I would just implore them to think twice. It's your life we're talking about. Patients can have heart disease at younger ages. The average age of a heart attack for a South Asian male that have heart attacks is in their 50s. For non-South Asians, the average age of a heart attack is in the 60s. So we're 10 years earlier at having our cardiovascular events than everyone else. So I would think twice about not trying to seek medical care.
I really hope that all our viewers who are watching this, they take one step further and pay attention to their cardiovascular health. Sati initiatives usually focus on preventative screening health as well as bringing most current knowledge and latest guidelines to community members. And I believe that in future, Sati will be having initiatives, projects, and programs. For example, they have currently a project based on the diet and lifestyles, which is called Sehat, which is focusing right now on the right kind of nutrition. What can you change in your diet in order to live a healthy life in future? So this was a really informative and very interesting discussion with you, Dr. Khanna. I really appreciate your time and your presence in this special Sati series on TVAsia Telugu channel. So I would like to thank you for your time. And I would say bye for now, but it's not the last time that we will have our Sati physicians on this show. Thank you so much, Dr. Khanna.
Thank you, Varsha. Anytime.
Thank you.